Welcome to the first responder meeting of 2022. It is our first quarter meeting, and then we'll meet again a few more times this year. But this time around, we have our training coordinator from Direction Home, Laurie Smith, is going to open us up with some health and wellness opportunities. And then we'll turn it over to Sam McCoy, our Senior Vice President of Elder Rights here at Direction Home, to talk about the Ombudsman program and what that looks like for first responders in facilities. So without further ado, I will turn it over to Laurie.
Hi, everybody. Thank you. As Courtney said, my name is Laurie Smith. I am the training coordinator here with Direction Home, and in that role, I do professional education, continuing education for our licensed individuals. And I also coordinate and lead our health and wellness programs. And I know I shared this information with this group, but it's been a while ago. I know there's some new faces with us today, and I think it's good for a refresher as well. So I will go ahead and dive in. I'm going to focus on one of our classes we've got right now. But as I wrap up, I will let you know that we have others available too, and we will be adding to our class availability as well. I'm going to start with some data. And I know I'm kind of preaching to the choir with this information. I know everybody here is well aware of this, but this data was pulled from the Ohio Department of Health, and it is falls-related data that they gathered in 2019. And this is just specifically looking at older adults in Ohio, so those age 65 and older. And in that population, 1 in 3 older adults fall every single year, and it is a leading cause of injury for that population. These falls cause about 60% of fatal traumatic brain injuries, and 57% of fall-related deaths occur in their home. Next slide, please. In 2019, these falls caused almost 1,500 deaths, just shy of 19,000 hospitalizations, and about 75,000 emergency department visits. And I can share these slides with this group after that. And if you want to see more in-depth information, there is the link to that website that you can go to and see more information. Next slide, please. This is a study that was done by the National Institute for Health, and it is data that was gathered between 2007 and 2016. And it wasn't to our local area here, but it was a very similar area, mid-sized suburban area. And what they found in gathering the data from all the calls that came into EMS, they found that 11% of them were related to older adults falling. And of that 11%, 29% of those folks called multiple times, and 15% called at least 5 times. So, again, I'm preaching to the choir here. You have what we kind of fondly refer to as frequent flyers. And we also know that some of those do result in transport to an emergency department, some don't. And 75% of people who were calling about falls for the first time, those folks did get transported to an emergency department, but 21% of the multiple calls were the ones that got transported. So it is taking up a lot of time and resources for our first responders. And again, if you'd like to go to that link, that will be there for more in-depth information. So in looking at that data, how can we at Direction Home help you as you continually get called out to these people's homes and you can clearly see they need assistance, and those people who are falling multiple times, they don't result in transport. So it's something that you're just helping them get up from wherever they've fallen, getting them immediately safe, and then you're on to your next call. We at Direction Home have health and education classes that can help build strength and flexibility. We have 2 classes built around falls prevention, and I would like to focus on our Taiji Chuan class. So this is an evidence-based program titled Taiji Chuan, Moving for Better Balance. And what it means by being evidence-based is it was pulled together by a team of experts, a team of medical professionals, and they found through data that it does indeed improve older adults' strength, flexibility, and balance. It does benefit older adults, community dwelling older adults who are at a higher risk for falls. We also gear it towards folks with Parkinson's disease who may be a little unsteady on their feet. And over the course of the workshop, people will learn 8 forms of Yang-style Tai Chi. And we also cover what we call mini therapeutic movements. And it's just small movements. All of them can be modified, but we focus on really gaining strength in our ankles, strength in our core, awareness of where our body is in space. We work on movements that can really improve that inner ear movement. That can actually be improved. And again, it increases balance, strength, and flexibility for everyone. Next slide, please. These classes for the community members are all free to attend. There is no charge for anyone to attend ever. And again, I said that it is evidence-based and data-driven results. And what they have found that by completing one of these workshops, there is a 55 to 58% improvement in balance. Each of these classes are led by trained and certified instructors. And there are 1-hour sessions that are held twice a week over the course of 24 weeks. And throughout the progression of these classes, these individual sessions, the complexity is increased as people's balance and strength also increase. And actually this picture here, the gentleman you see that's facing us in the white t-shirt and black pants, that is actually the doctor that developed this program. And he still does actively go out and lead these classes. Next slide, please. So where do we hold these? That's a question that I'm asked all the time. Prior to the pandemic, we did hold them in person, and it was on a by request basis. So we would hold them at libraries. We held them at senior centers, church groups, and we can still do that as, knock on wood, the pandemic situation is improving. We would like to get back out there in person. And by doing them in person, I find it much easier to actually lay eyes on these people and make sure they are doing the forms correctly and making sure that their balance is there, making sure they're very safe. And along with that, you get that social interaction that oftentimes older adults are lacking. So you get them together and they get that social interaction, and it helps to combat a little bit of depression. With the pandemic, though, we were able to flip these classes to a virtual format, and I've been holding them on Zoom very successfully. They are very well attended. And that, of course, helps with being socially distant and keeping people healthy and safe. People don't have to worry about any travel. Since it is a class that is fairly long-term, a lot of times we'll run into bad weather and nobody has to worry about driving anywhere. And then, of course, we can have a broader reach too, where when you're in a physical location, somebody may not want to drive a half an hour to get to that class. So no matter where somebody is physically located, they can log in and attend these classes. Next slide, please. Something we have just started doing is contracting with what we are calling host site partners. And there are benefits to becoming a host site partner. But places we are looking at are libraries and churches, congregate meal sites, senior centers, and YMCAs. Now that is by all stretches of the imagination, not a complete list, but this is a good glance at the places we are looking at to become host site partners with. And these are all places that older adults are familiar with and they visit frequently. And there are benefits to becoming a host site. One, it is a unique way to both serve and engage your population. It's a new program that can be offered. And by contracting with us, excuse me, there is monetary compensation. So for something of this length of a workshop, and again, it's 48 sessions, 24 sessions long, just for the use of the physical space or the use of your internet, should you choose to do it virtually, there is $100 to be able to use that space. And then for each person attending a class and is considered a completer, and that is somebody who attends at least 75% of those individual sessions, the location will get $25 for each and every completer that goes through that class. We offer ongoing program support. We offer technical support, any questions about staying true to the program, and the program developers do ask that we lead it in the manner that they have developed it, because one, again, it is research-based and they want to make sure that their information is shared correctly. But also for standardization, no matter who is leading that class, it looks the same and people are getting those same benefits. So we offer program support in keeping people on track and answering any questions as to how the program should be led. And then we are also able to help them get their staff, if they choose, trained to be leaders. So we can assist in all those ways. Next slide, please. So who do we look for when we are looking for people to lead this class? Anyone. Somebody who obviously loves to teach, who is passionate about helping our older adult population. When you see not a professional, we, of course, all on this call are professionals doing whatever you might be doing. But when we're leading this class, we're taking that professional hat off. You are not a first responder. I am not a training coordinator. Somebody else who may be a nurse, we don't want them walking in with that nurse hat. We're not diagnosing anybody with these classes. We are a true peer to the people that are taking the classes and helping them along their journey. So anybody who fits those qualifications, we are more than welcome to talk further about becoming a certified leader of Taiji Chuan. Next slide, please. In becoming a leader, again, that can either be in connection with a possible host site, or if you're not associated with the host site, we can still talk about becoming a leader if there is interest, and there are benefits to that as well. We cover the cost of your training. So there is absolutely no out-of-pocket cost to you to be trained, either initial or there is ongoing kind of refresher trainings to kind of brush up your skills. You also would get that ongoing support from us. We offer marketing materials to both the host site and the leaders. There are things, since this is an evidence-based workshop, we do ask for some demographic info to be sent back to us, and progress notes as well. There's pre and post evaluations to measure how well these people are improving that are taking the session. We help with that as well. And here again, there is some monetary compensation. So for each and every individual session that somebody leads, they will receive $25 for each session led. And that is, with those 48 sessions, up to $1,200. With the length of that class, we do, of course, understand that things happen, life happens. Somebody may get sick or something with the family might come up, vacations. So if it is a matter of becoming a substitute leader and just filling in for someone who can't be there that day, the compensation would be $35 for that class to be led. Next slide, please. So how can you help us with these classes? Next slide, please. Please make referrals as you are out and about and seeing these individuals who need some help with their balance. They could have their quality of life improved. We have these little postcard-sized things that we know you can't give us their information due to HIPAA, but we have postcards that you can carry with you. And if you see somebody that you feel may benefit from these classes, you can just give them this card and say, hey, this organization has these workshops free to attend that might be able to help you. Please give them a call. We also have a referral page on our website, and that's our web address right there that will get you to our homepage. And when you go to our homepage, this is immediately what you'll see. And just underneath, we focus on the person, not the problem. You'll see those 3 buttons there. And the one on the far right, I know this one is hard to see, but the far right blue button says make a referral. And when you click that button, this is what the referral page looks like. This is just a snapshot of it, and you can fill that out. We can review that and then contact that person with interest in taking maybe one of these classes to help benefit them. Next slide, please. So with all that in mind, I would, one, love for you to make referrals to us so we can help your population and free up some of your time and resources. And it also helps our population as well, get them healthy and strong and able to age in their homes. But along with that, if you know of any organization, if you are a member of a church congregation who you feel might want to bring this into their program and help the congregation, older adult congregation, or if you visit a library or are associated with a library, or you know of a senior center that might be interested in bringing this in to their location, let me know. I'd be absolutely happy to talk with them. Or if you or yourself know somebody who is interested in becoming a Taiji Chuan leader, again, contact me. This is my information there. Feel free to call or email me anytime. I'm more than happy to help. And with that, are there any questions for me at all?
There was one in the chat, and I just wanted you to confirm. I believe that anyone outside of our 4-county area is able to participate as a participant in a Taiji Chuan class. Yeah, absolutely. You know, our area agency on aging covers Start Summit, Portage and Wayne, and we do want to focus on those folks. But I've had someone from Texas attend my classes virtually. I had somebody, Courtney, where was she from? Not the Philippines. Was it the Philippines? It was somewhere overseas. Yeah, it was the Philippines. Mm-hmm. Philippines. She would log in. It was 9 in the morning to us and 9 in the evening for her. And she logged in. So yeah, anybody can absolutely log in and join these classes. And then also, are you doing you're doing a class in person or online soon? I will be doing a class online beginning in March. And once that one wraps up, hopefully by that time, I don't want to say it, but I'm so afraid of jinxing it. Hopefully after that one wraps up, I can get back to doing them in person, but I still won't let go of the virtual just because it's easier for a lot of people to attend. There are people that prefer the virtual. No, I'm not doing one in the well, but that would be a fantastic location. All right. Anything else I can answer, get a hold of me. I am happy to help. Thank you so much. Thank you. And this is, I'm recording, so we'll have it posted onto our YouTube channel as well. So if you know anyone who could benefit from the information or that would need to revisit some of the things that Laurie or Sam are covering today, you can feel free to do that. And with that, I will turn it over to Sam.
Thank you, Courtney, and thanks, Laurie. It's really a pleasure to be part of the presentation today. I want to introduce maybe some of you to the Long-Term Care Ombudsman program, maybe a bit about our principles, kind of the drivers and motivators that we have as advocates, and also talk about some trends that we've identified here locally, and some trends in issues and concerns across the state. So we'll get underway. Here's a quick overview of what we do as Ombudsman, and primarily you see that our job is to investigate and resolve complaints. And those complaints can come from anyone. They come, typically they come from families and residents, but we also respond to complaints from providers, from the long-term care industry folks themselves, adult protective services, the courts, doctors, first responders, and practically, you know, visitors in facilities. Anyone can call us. And I think the important aspect here is calls are anonymous, and confidential. You do not have to disclose who you are and why you called and so forth. But we're certainly interested in getting those calls and responding to the issues and the observations that anyone might see. We provide lots of information to consumers. You know, people in the nursing home, our family members and others. This is a very new experience, typically. And so there are a lot of questions about rights, about process that one might occur and encounter in a facility. advocate for changes in legislation. Here, just at the turn of the year, the governor signed what's called Esther's Law, which will now permit residents in long-term care facilities, nursing homes in particular, to have a camera installed in their rooms. And we were involved with providing advocacy and suggestions on that law as it went through the legislature. We're interested in what's happening in the industry itself. So we typically make visits to new facilities, find out what's going on, who's their clientele, what's their ideal clientele expected to be, management questions and those kinds of things. And then we offer the industry rights-based information and changes. And we do that because we're advocates and we can't help ourselves. And then finally, I'll mention that really a very important aspect of what we do is to maintain a presence in facilities. Folks have to know who we are and what we do to be compelled to give us a call. Principles we operate by, we support that right of self-determination. We firmly believe that an individual with the capacity to make decisions has the right to make that decision for themselves, not the granddaughter, not the son, not the well-meaning family member, not the facility, but the individual, him or herself. And we follow their direction. That's really an important piece of what we do. I don't get to make decisions for our clients, nor do the ombudsman who are assisting them. It all flows back to the client. Informed consent is critical. People need to know what they're agreeing to, and they have to understand the consequences of that. Confidentiality, of course, is a very important principle. The number one issue that prevents consumers and family members from calling us is they don't want to be labeled as a complainer. They don't want to be labeled as a problem resident. So they hesitate to give us a call. But we are diligent in protecting the confidentiality of anyone who talks with us or provides us information. And of course, protecting the rights of all consumers, regardless of where they live, regardless of what they call home. Might be in the community, assisted living, and nursing homes, of course. Thank you. Next slide, please. Our responsibility, again, investigate and resolve those complaints, public education, doing the kinds of presentations that I'm doing now, information to everyone, monitor those laws, and maintain that presence. I like to say what we're not, because there's often a confusion about what our role really is. I don't get to turn up the collar on my coat and put on dark glasses and get to sneak around, as fun as that might be. That's not the way that we operate. We're above board. The facilities know us, administrators, social workers, others know us. We're known entities. We're a known entity in the long-term care continuum. We're not authorized to levy fines, close facilities, terminate employees. Often we may get a disgruntled family member or someone call us and say, I want this facility closed. I can't do that. I don't have that authority. And I think most importantly is we're not neutral. There's a misconception that we somehow look at both sides of an issue and try to judge who's more right than another. Again, we are all advocates. We are not neutral. Our service area, you maybe are all familiar with our purple area there, our 10B, Direction Home region, 4 counties, but we also have an office in Dover covering 9 counties in southeastern Ohio, in those rural counties down there. Here's a little snapshot of what of kind of our territory: 413 licensed and certified facilities. Actually, there's more than that now. I think we're closer to 430. It staggers me to think that that might include over 25,000 residents in those facilities at the full capacity. What we're seeing recently, of course, is residents are coming to their long-term care facilities more acutely ill. We all know and have experienced the fact that you don't stay in the hospital like you used to. You're in for a matter of very few days typically, and you are transferred to a long-term care facility, for example, for physical therapy and for recuperation after a fractured hip, for example. But folks are typically much more ill than they have been in the past over my career. Also, we see an increased need for behavioral health interventions in long-term care facilities, as many of the community-based options either are not available or other hospitalization options are not available. The residents end up in a long-term care facility. And one of the important dynamics of my world as an advocate is there's just absolutely constant turnover in facilities. Residents typically do not have a long stay, and that's very different than what we used to see. They're in short term for therapy, for example. They're in for a couple of months. Maybe less, they recuperated and they're out, and that bed's filled with another resident who doesn't know about the long-term care ombudsman, who doesn't know what their rights might be, who's not familiar with advocates and not familiar with the protections that are in place. Next slide, please. Here's a quick little view of our past program year. This was in 2021. I say, and many of my friends on the presentation today will hear me say, nobody calls us happy. People call us unhappy. They're frustrated, they're annoyed. They've gone through all the channels they can go through and they're not satisfied. So last year, over 2,400 people had complaints that came to our attention, and we were able to verify 72% of those complaints, meaning that given following our investigation, we find that it was more likely than not that the information we received was accurate, and that's good. We do have complaints that are unverified. People make up stuff and call us. Sometimes to get back at maybe a coworker, sometimes to get back at a facility or a former employer, those sorts of things, but we sort that out. I'm really proud to say that over 90% of our complaints during that period of time were resolved or partially resolved. And simply put, that means, gosh, things are better after they call us. We can't turn the clock back. We can't, there's many things that we can't completely resolve because it's an occurrence that's from the past. But 90% of the folks that involve us are satisfied, and their issue has been partially or completely resolved. As you can see from the sources data there beneath, most of our complainants and our complaints that we respond to are in nursing homes. That's where the residents live. That's where the vast majority of our clients live. 75%, 22% of those complaints came from assisted living. Interestingly enough, the assisted living complaints have gone up, I think, every year in the last decade. I think it's more and more of a concern, at least for me as an advocate, what's going on in assisted living facilities. And then 3% of our complaints come from adult care types, board and care types, home, community setting, and other areas. Geez, it's been a busy year. all complaints compared with year 2020. All of our complaints were up 29%. Nursing home complaints alone up 26, assisted living complaints up 52%. And that's a staggering increase in the complaint volume in those settings. And that's really something that, as I mentioned, concerns me as an advocate. What were our complaints in 2021? This is from the nursing home. Care planning, there was not a sufficient time spent in determining what the individual residents' specific needs were and getting those into a plan, getting them into a plan that requires a response from the facility. Discharge and eviction continues to be a frequent complaint that we have. Most typically, this is due to non-payment. The Medicaid system is confusing. We have families and we have folks that think they can outwit Uncle Sam. Yeah, I'm sorry, you can't do that. And so sometimes Social Security checks are not turned over. Funds are not appropriately spent on long-term care, and a big bill results and eviction or discharge occurs. And residents, you may know, as in any other residential setting, residents and families can appeal those discharges and eviction. It's an important part of what we do. If you remember, 2021, visitation was prohibited in many of our facilities, and it was an enormous problem for families and for residents. So was response to requests for assistance. This was call light response. This was calls for help that came from residents that there was the response either was lacking or didn't occur. Most concerning of all of these is that final one that I see, dignity and respect. The staff of long-term care facilities are grossly overworked, underpaid, underrespected in many cases. And when they were working with a difficult patient, a difficult resident, maybe a resistive resident, it occurs that an individual caregiver will talk back, will sass a resident, will belittle a resident, and that's what dignity and respect is. It is not verbal abuse, but I really do think it's a precursor to verbal and physical abuse. Next slide, please. What's happening in assisted living? The same kinds of complaints. Visitation, however, meal and food service was a familiar and very typical call that we received. You may recall that many residents in the assisted livings were required to eat in their rooms, and we would have calls from residents and families in really opulent, beautiful assisted living facilities that had to eat in their rooms, and it was a difficult time for everyone. It was necessary at the time, but it didn't meet their expectations. Discharge and evictions again. Billing and charges for care in the assisted living world was a problem. As you may know, this is most frequently a private pay venue. And then again, the response to requests for assistance. There's not a lot of staff available in the AL. Okay, next please, thank you. I wanted to look at the first couple of months of our calendar year here and see how it differed from last year. And as you see on your left, visitation was an issue that doesn't occur this year because visitation is open, it's not restricted. Response to requests for assistance continues to be a familiar complaint, but it's lower now than it was before. Access to information, quite honestly, was the fact that in many cases telephones weren't weren't being answered because the secretary or the individual who was charged with the phone responses wasn't at his or her desk. They were providing care. And so that was a problem. Care playing again, dignity and respect. And you see many of those same complaints in our January through February 22. However, the real difference here is in 22, in January and February of 22, these were actions for which the facility was responsible that were not getting completed. And really the root cause of medication problems, symptoms not being addressed, food and meal services, many times the root cause of this was staffing problem. And so it was very different from our perspective as advocates. Next slide, please. So how's Ohio done here through the impact of COVID? I got some slides from the Consumer Voice. This is a national advocacy group out of Washington, and I think there's really some fascinating information here. The blue data is Ohio, okay? And the orange or red is United States, the nation. And what we see here, this is the number of residents with depression symptoms. And we see Ohio much higher than the national averages. And we see, if you look at the timeline, I know it's hard to see, but if you look at 2019 and 2020, that's when things really begin to shoot up. That's when COVID really began to hit here in our long-term care facilities. So not surprising to many, visitation is not permitted. Isolation becomes the norm. We see more depressive diagnoses. Weight loss. And this shows the increase again in the weight loss of 10% or more in the last month or in a period of 6 months. Mealtime is a social time, and when residents were eating in their rooms, that social aspect of work wasn't present, and it made a real difference. Now you'll see a steep drop there in 2021. Particularly in the second quarter and on of 2021. And really that, I think that correlates with the fact that visitation is now open and residents can come in and help family members can come in and help at meal times. So instead of dropping a meal off at a resident's room and coming back an hour or so later and picking up the tray, there were some real interventions by family and others, visitors and others, to be involved with mealtime. So glad to see that change. Okay. Antipsychotic use during the period, I think, has increased, and during the COVID era here, as you're seeing, and I think again this correlates to availability of staff, and all those restrictions that occurred during this period of time. People couldn't go out. People couldn't go out and smoke. Access, even within the facility, was in many cases significantly curtailed, and that has a real impact on behavior, and hence an impact on the use of antipsychotic medications to manage behaviors. Not surprisingly, again, the diagnoses of schizophrenia began to edge up during this period of time as well. And this, I'm told, may correlate, in fact, with the use of the antipsychotic drugs, because the diagnosis is required before the medication is ordered for the patient. So this kind of goes hand in hand with the use of antipsychotic medications. Pressure ulcers, here Ohio was down a little bit. I mean, beneath a national average, which was good to see. But again, here in the third quarter, second quarter plus of 2021, we begin to see a decline in pressure ulcers. But I want to say as an advocate that every one of these issues continues to be an issue in the state of Ohio. This and here locally, this aggregate data is important to show some declines, but when you look at this one, for example, there's still decubitus and pressure ulcers above 7% of our residents in long-term care facilities. Next slide, please. I tossed this in because I thought it was interesting to again compare our workforce with other states. The percent of residents vaccinated in Ohio is beneath the national average, the residents with boosters below national average, number of staff vaccinated really significantly below the national average. And we know that Ohio has a vaccine mandate for caregivers in long-term care facilities and hospitals. So we may see that this does increase. This does not take into consideration those facilities or those individual caregivers who have received a waiver either for religious or medical purposes. So we know that some of that's going on as well. Next slide, please. Here's how you can, did we skip one or did I miss one? Miss a slide? Maybe not. Here's where we can be reached. This is the Direction Home main line. You can call and ask for an ombudsman, and you'll be routed to a real live person who will be able to talk with you and work with you. And do I have a final slide, Courtney? No. I wanted to mention, and I guess it didn't get on into my deck, that for first responders in particular, we know that you are in facilities and you observe and you see things that may not get reported to us in any other way. You may be called to transport a resident who doesn't want to be transported. You may be called to take an individual who's been in an accident or had skin tears or any number of issues. Those types of things can be reported to us. We would appreciate being informed of those because it will give us the heads up on what's going on in that facility. When you saw the number of facilities, 400 plus facilities, there's no way that we can be aware of what's going on in those homes at all times. We use a lot of volunteers. I encourage those who might be on the call to consider becoming a certified ombudsman volunteer. We're happy to talk with you and work with you to reach that that status as a certified volunteer, and happy to help you as part of our team. As my friend Matt and I often say, the key to getting us involved is just to call us. We want to be called. We can give you the direction. You don't have to know the 32 resident rights of residents in long-term care facilities. I wouldn't expect you to, but we do. And calling us can really be helpful. Can really be helpful to families and really be helpful to residents as they navigate their experience in long-term care facilities. I'd be happy to respond to any complaints any questions that maybe you got complaints. I don't know. I'm happy to hear complaints. If you have questions about kind of our role, about how you might become involved, I'm happy to respond to those. Or Courtney, if you have anything in the chat, I'm happy to respond to those as well.
Nothing in the chat so far, but please feel free to, we still have a little bit of time here. So if you have any questions, feel free to pop those in. I also, or unmute yourself. We're always happy to actually hear voices these days. So don't be shy there. But I have a question for you, Sam. Could you offer a little bit of your expertise and advice for maybe a first responder who finds themselves in a pinch at a facility where maybe they're showing up later in the evening after our business hours are over for the day and everything, and they're really just not sure? It seems like a situation that they would need to report, or maybe it seems like they're being called in a way that seems like overstepping and violating some of those rights and boundaries. What should they do in a last minute type of situation like that?
Yeah, that's a good question, and probably not an unfamiliar circumstance, Courtney. We know from our experience that first responders are called into the facility sometimes for lots of reasons, by lots of people. They can be called by the facility. Certainly we have, with an issue that maybe they are, that the facility can't handle. Maybe you have a disruptive patient, a resident who's being aggressive, that sort of thing. I know that first responders are really the experts in de-escalating a situation. And I know that they have the skills to do that. I think what's important, what we like to see occur, is we like to see and be assured that the resident's voice is heard here. And I know that that's taken into consideration, as in the case that a resident would be transferred to the transported to the hospital or to another setting. But it's important to hear from them and to take what they say into consideration. And I know that's there's pressure. A lot of pressure on responders to get in, to get out, because my goodness, you were literally running in circles during the worst of the COVID days. But I think that's an important thing, to take that resident's voice into consideration and really look at the circumstance here, to consider and question, why am I being called? Why am I being called as the EMS staff? Why am I being called into this situation? Is this something that the facility rightfully can handle, on their own, and they don't need me here? I think at times EMS and others are called into the facility because the facility maybe is at wit's end and they want something to happen ASAP. I also know that residents call responders, and we have residents in long-term care facilities who have called and continue to call EMS because no one answered their call light, or because they needed to be toileted, or because they didn't get their meal delivered. Certainly those calls, I think, should come to me. We are not first responders, but we would certainly, an individual, anyone can leave us a voicemail. It'll come to Elder Rights and we will respond. It can come from our website as well. Courtney, you mentioned, Laurie, you mentioned our website. Under the Elder Rights banner on our website, a written referral can be made, and I can assure you that we will follow up. I think, to answer the question, in that moment, Courtney, of pressure, of indecision of what to do, I think we would suggest you always turn to the professionals at the facility, the administrator, the nursing staff, and whomever, to really question, why am I here, and why are you unable to handle this? Because that's why they are there, right? That's why they are there. That's what they're being paid for. And times, you know, the folks want to push that responsibility off to somebody else. That's a long answer to a short question. I'm sorry.
Not at all. That's perfect. Thank you. There is a question in the chat here. From an ombudsman's perspective, how can facilities address or balance resident concerns and lack of staffing? Should census be reduced even beyond ratio requirements?
Yeah. Really a good question. And we see this firsthand every day in our lives as advocates. Facilities really have, I think facilities are being staffed literally shift by shift. That the HR folks and the DONs and the administrators are looking now to fill the midnight shift or the third shift here today. I think facilities have to use all the resources that are available to them. And what's that meant to many facilities is that they have to fall back on pool staff or agency staff. And believe me, I know that creates a financial burden upon the facility. I know also that facilities have received funds from the state and federal government to help with the expenses of staffing. And I don't know how they might be used in any of the individual facilities, but you know, again, I would say as an advocate that the residents come first, and facilities are being trusted with meeting the needs of those residents, regardless of the difficulty in filling that slot. I mean, it's just something that needs to be done because it's a statutory requirement. So I think that comes first. It's not an easy thing to do, and we empathize with the facilities that have to do that. And believe me, we empathize with the hands-on caregiving staff who are being asked to work double shifts, working multiple days on one after another. They're being asked to fill in on their day off, and they've got children and they've got families, and it's a tough industry. I was in the industry, you may know, a number of years ago, and it's a very different world than it's ever been. I think residents come first. And it comes at a cost. I mean, that comes at a cost to the facility. It's not about the bottom line. It's about preserving the health of those residents. And I would say to facilities, there's no easy answer here, and maybe it comes through only the expensive charge nurse or the expensive agency nurses and staff that have to be utilized. And that's not a good answer. I got that.
Thanks, Sam.
Yep.
Any other questions while we still have them on the line here? Last call there. I'll give a minute in the chat box just in case anyone wants to drop any burning questions at the last minute. And I'll just go through our contact screen in the meantime. So Laurie's information is here as well as Sam's and my own in case you have any topic suggestions. Our next meeting is going to be a dementia-friendly training, and that'll be in late spring, early summer of 2022. And then our fall quarterly first responder meeting will kind of follow up on today's. We're looking at different options for power of attorney, living wills, stuff like that. Our contact information here at Direction Home is on the right side there. You can contact our Aging and Disability Resource Center using that email address or that phone number. There is a link to our referral page. It is incorrect. It is dhad.org/refer. My apologies there. I'll update this when I send out the slides later. So it will be uploaded correctly in those. And then we do have an Ombudsman Facebook page to keep up with anything that's going on in the Ombudsman world, in our region, anything like that. And then the phone number to talk to an Ombudsman is also listed there. And then there are some good links that Matt dropped into the chat, including the elder rights referral link that Sam mentioned. That is in there, and we'll include those in the email following up on today's meeting next week with linking to the recording of this session. I think that is everything that I had to say, and I don't see anything else in the chat, so I'll leave it open if anyone wants to unmute and ask a question, but if not, thank you all for taking the time out of your day to join us again. It's always appreciated. And Sam and Laurie, thank you both for your time and expertise. It's been really great information today.